South Africa is regarded as the epicenter of the HIV epidemic globally. And if you look at the population of South Africa right now, I think it's estimated at about 58 million people. And of those 58 million people, estimates tell us that almost 8 million are living with HIV.
It's not epidemic control if there is poor quality of service. It's not universal health coverage if there is poor care systems and processes. So for us to reach epidemic control, it means we need to improve our care processes to ensure that at the end of the day, patients receive the care that they need. The care that is provided is consistent with professional standards.
OPIQ stands for Optimizing Performance by Improving Quality. It's a collaboration between the South African National Department of Health, the University of California, San Francisco, and PEPFAR, with funding from the Center for Disease Control and Prevention.
The cornerstone of this project has been through partnerships. We work very closely with the Department of Health at all levels, at the national level, provincial level, as well as the district level. However, we've really received a lot of support through partnerships working with the district support partners. These are partners funded by CDC, and these partners include Health Systems Trust, the Oram Institute, TB HIV Care, and Vets RHI.
Quality improvement has had a profound effect on HIV care. It's been particularly important because the areas of HIV that are so challenging have to do with continuous engagement and care. And so understanding how to work with people in the systems, both in the healthcare facility and the community, I think has been a really important opportunity in which to apply quality improvement work.
The baseline assessment is one of the critical tools for quality improvement. Before we even begin to support the health facility, it's always critical that we get to understand more of the health facility. And so it acts as a desktop review where you actually want to establish in terms of what exists at base.
So a QI collaborative consists of a group of individuals that are working towards a common goal for a focus area. And you'll find that they will be working with specific measurements that are really defined over a period of time. So what then happens is that the teams that are part of the collaborative, they accelerate changes at their facilities through what we call rapid cycles of tests. And then they will do a little bit of data review on a more frequent basis just to assess the impact of the changes that they have done at their facilities. So on a more periodic basis, they do meet and share the lessons, and what has been deemed to be a success will then get to be spread to the other facilities that are forming part of the collaborative.
So the learning sessions are a platform where we bring together people that are involved in the design and implementation of healthcare services. So that includes the quality improvement teams, which are made up of the multidisciplinary cadres from the health facilities, including also community and patient representatives. We also made sure that the Department of Health at different levels is represented in the learning sessions. And then in addition, we also made sure that our district support partners participate in these processes, because they are the ones that are also directly supporting the teams on the ground to improve these processes.
When we started the project, one of the key deliverables from the funder was that for OPIQ to work with the implementing partners to identify, pockets of change ideas that have been proven to work of course supported by data.
A spotlight is one change from one facility. It gives us an opportunity to share these success stories with other facilities, giving them enough information that they could potentially implement it in their facility and test it using the same cycles. So we include a concise description, a step-by-step implementation guide, and make it colorful and graphic so that it's easy to read for the busy clinic worker.
The whole idea of hosting writing workshops for staff from DO8 as well as the DSPs to just take them through the process of identifying change ideas that are impactful, supported by data, and then making sure that we train them on how to write in a way that is concise but still send the message across.
And I'm also very proud of the Spotlights Compendium, which we developed not very long ago. There's also the Tracing and Recall script, which was developed and translated into 8 languages by OPIQ. That has since been adopted by the National Department of Health to be used in their upcoming Welcome Back campaign.
I think we've seen through this project that people who are on the ground in HIV service delivery really know best what is going on and how gaps are formed in this care system and how we can work to overcome these gaps with the resources we have on hand, being practical, being considerate of patient experience and also healthcare worker experience at the same time.
I think that when people get bitten by the bug to focus on quality, they want to keep doing it, and they're not going to let go. So that from the demand side as well as from the provider side, I have optimism that it will continue.